These are highlights from the show you are about to see. Watch this video for an excellent summary of what it takes to work as a veterinary surgeon with leopard cats. Veterinary surgeon Dr. Anh Ngoc Truong has always liked wildlife. As a youngster, she knew she wanted to help wildlife. She attended vet school and then went on to do internships. Her degree was completed in Vietnam, but validated by the University of Queensland, UQ as she puts it. During university, she established a wildlife veterinary students club for those undergraduates who wanted to work with wildlife to talk about what jobs were available. In the first year, she also started looking for internships. After qualifying as a veterinary surgeon in Vietnam, she did a master's degree in clinical care of exotic animals. Leopard cats evolved between 8.76 and 4.53 million years ago. If you're learning English as a second language, this video will be useful because you will hear a Vietnamese and a British accent. And before we go any further, I would like to say thank you to my subscribers. Without you, there would be no channel. I appreciate the support of each and every one of you. Managing recovering populations of wild leopard cats as a veterinary surgeon and living the wildlife looks like this. And for people watching this who are extremely curious about leopard cats, what jobs are there with leopard cats?
So with leopard cats, we can be the veterinarian like me, or biologist for research, or conservation officer, like anti-poacher, or rangers, like animal welfare specialist for leopard cats, or academic researcher. Also really helpful for working and getting knowledge about the species, or any education work relates for the community, for students.
So for people who are really quite prepared to get creative in their job search, there's quite a few
Yeah,
opportunities with leopard cats. That's great.
that's,
What do you do?
I am a wildlife veterinarian, and I'm working in the rescue centers, where we mostly rescue pangolins and small carnivores, such as leopard cats. So during the work, usually I will conducting the health check for the animals, rescue them, and then the most important is, I would say, treatments and diagnose what the problem is right now when I receive or when I rescue the animals. And then the rehabilitations is a really important part, which is we can make a decision that the animal can be released in the wild, could survive. And also in the rescue centers, I manage the quarantine protocol, which is really important because we receive also the other animals and also help the other centers. So maintenance and keep strict on the quarantine protocol is really helpful. Also, usually for leopard cats in Vietnam, like we confiscate, and usually they have like the necrotic wounds and stuff like that by the trap or the snare. So we do the surgeries like amputations, bone fixings. Yeah. Also, we collaborate with the other organizations and other rescue centers, also support the I would say like local departments of the government. to help them understand how to taking care for the leopard cats, how to treat for them, and how to release or how to access their ability to be released.
Oh, that's great. How do you access, how do you evaluate their suitability for release, Anne?
So usually we would test for their ability of movement, like climbing. For some of the leopard cats, we have to do the amputation. I do know that in some country, when we do amputate one limb of the cat or the feline, usually they will prefer to euthanize. But we have performed the surgery like amputation for cats, leopard cats in the past, and we release and we actually keep tracking on it by release in the area that have a ranger stay close by. So we observed that the leopard cat actually survived through years until now. He's still here. That's amazing. So that we try to rethinking that they actually can be released, but it just need to be more careful. So in say Vietnam Wildlife, we put the leopard cats that have any problems or even like healthy, or we do the hand rear from the captivities, and they need to not habituate to human first things. Second things, they can hunt. So like we hang food or we put food like all around the floor or we hide it. And after they complete the task in the enclosures, we move the animals into semi-wide. And then we also do exactly the same thing. After they going well, we will do like another last check, and we release.
That's brilliant. So to be clear, a leopard cat that has been through an amputation procedure and has 3 limbs can
Yes.
survive in the wild.
Yes, but only front limbs. If the leopard cats have the wounds on the hind limbs, we will euthanize.
And you are a vet working with Vietnamese wildlife, including leopard cats and other species too. For somebody who wants to take you as a role model and to emulate how your career developed, please can you say, how did your career develop, please?
So basically, I pretty like wildlife when I was a kid. So I do some research about what I can do in wildlife, and I saw it's really rare opportunity or like even jobs information for wildlife in Vietnam at that time. And I just think that I want to taking care for the animals. So I really like to close contact to them, see them healthy and good at manage the wound somehow for my dog and my cats in like small minor things. So I decided to be the vet. And when I start my vet school for a first year, I also looking for the opportunities to join some like internship, like short internship, and apply for some scholarship that's they funding for short time, so I can have ability to get know what is wildlife is. Then after finish, actually during my university, I established I called it Wildlife Student Club because I also want the other student in the university have the opportunity to know what is wildlife and what if they want to work with wildlife, what the job can be, how can is it done in the advanced pretty much vet knowledge related. And after graduate, I go straight work in wildlife because during my school time in university, I also intern in pretty much clinic or companion hospital, which is also helpful because I just need a skill how to handle the animals, how to injections, giving the medication, like the basic things. And then I go work in the wildlife. During my work over here, I'm living inside the jungles. So beside of my busy time, I also learning something else beside like my master degree, but it's related to the exotics. Then just continue with that and learning things in the conference, in the seminar or the workshop like.
And how long does it take to do the course in veterinary medicine in Vietnam? Is it 5 years?
So right now we have two programs. One is like Vietnamese program is like 5 years. But the program that I'm studying is like program from Queensland University from Australia. So it took like 5.5 or 6 years.
Is it competitive to get into Queensland?
University is quite difficult to get in.
And in your capacity as a veterinary surgeon, what skills do you need to conduct a full clinical examination on a leopard cat?
So for the leopard cats, it's pretty, I mean, for all feline in general, they quite easy to get stressed. So the basic thing is like, you know, how to handling them. So like I would say handling technique, diagnose by observations, and other more close techniques like palpation, osculations, or yeah, something like that. And also blood collections because it's really, really important. And some of the cats is pretty difficult to get the veins because they small. And in the winter, we're trying to limit shaving the animals because it's so cold in here. So it's also more difficult for to collect the blood sample. Uh, I mean, for leopard cat, it's pretty much same with cats, just different species. So also ultrasound techniques, radiograph techniques, X-rays, and especially the anesthetic management for sedation or minor procedures or yeah.
Fascinating. And what skills do aspiring graduate veterinarians who want to specialize with leopard cats usually lack?
Usually lack is because in general, not a lot of I would say rescue centers in Vietnam that work with wildlife, especially the government one. They lack of the money and the capacity and also the equipment, so they don't have the monitors. So I would say like the anesthesia and the sedation protocol. Secondly is like the species specific disease in like epidemiology relates in the population, in the wild populations. Fieldwork skill like in the wild, for example, the if I go to release or the rescue animals, we pretty much don't have so many choice of equipments that we need. So we need to prioritize which one we have to do first. And the communication skill, especially for me as a woman working in this areas or wildlife areas, and it's pretty difficult for me to communicate effectively with people with the government because they usually show more respect with men more than women.
How can a new graduate in veterinary medicine and acquire the skills with leopard cats that they will need?
Uh, as I say, like leopard cats, pretty much like domestic cats. Also, they also have, of course, they will have some differences, but it's not much. So I would say like internship or trying to join some clinic or the hospital, companion hospital for training your skill in the other, like even soft skill or technique skill would be helpful for working with the leopard cats. And maybe you can also participate in some conservation project, so they will help or they will have the like the senior vets that already have the experience in leopard cats that can show you. Especially, I think pretty much usually students just graduate, they quite lack of like proactive attitude. Like they're pretty shy to ask. So I think asking is very important skill that they need to do or they need to learn.
And for people who want to become wildlife biologists in Vietnam, with a view to specializing in felines, leopard cats, do they need just a degree, or do they need a higher degree, a master's, or even a PhD? Does it make any difference?
For biologists, to be honest, I'm not sure, but I can answer for the vets. So for the vets, personally, to work with the leopard cats, we don't really need to have the higher education. I think just for me, like DVM is already enough. I study master degree because it's different species, it's exotic species, and I might need it for the futures, or even like right now, I also help the others, so like I need it. But for leopard cats, just
So you have
DVM is
a master's specializing in wildlife medicine.
not wildlife medicine, it's like exotics medicines and surgeries, but it's more related to practical one. So I only study like 1 year because it's practical. I don't do deep research or something like that, so I don't have to do 2 years.
And Anne, do you have to sedate a leopard cat for almost any clinical procedure?
In say Vietnam Wildlife, I'm working in say Vietnam Wildlife right now, so we do have it. And usually the step was like pre-sedation assessment. So we observe the animals, we fasting the animals, and then you choose the like I will call like drug selections, what kind of the anesthetic combination. In say Vietnam Wildlife, we have two types. One is like ketamine and medetomidine, otherwise ketamine and midazolam. And then we reverse with atipamezole. And when we finished of choosing the drugs, we can adjust the dose, depends on the age. I would say that the stress of them can reduce the effectiveness of the drugs. So we base on these things and adjust the dose for them. And then usually we will give the medication by capture the animals in the restrict cage. Overkill, we can also use darts, but leopard cat is quite small and it's pretty dangerous if we're using darts for them. Because this can go, if they go wrong directions or go too deep, they can touch the vessels or the nerve, which is more harmful for the animals. This is the important part, is monitor the animals during the sedation process. So we have to watch out with the heart rate, respiratory rate, the oxygen levels in the blood, temperatures, and how deep of the anesthesia going by eye reflex or ear reflex. Yeah.
Oh, that's really interesting. And how would you describe leopard cat clinical care in Vietnam today? And what effect, if any, does politics have?
We pretty much improving compared to the past. Second thing is like lack of the equipment. In say Vietnam Wildlife, we also don't deal with this problem that much, but in the government rescue centers, they super lack of it, and we pretty appreciate that some of the donor from overseas can come visit, and then they donate some equipment for them to improve the ability of work. In Vietnam, also we confiscate a lot of animals, so we deal with the high rescue center workload due to the illegal wildlife trade or confiscate. With the political impact, I think right now they need, or they're getting stronger laws for wildlife protections compared to the past. And the government, as I say, the government and NGO partnership or really help to improve the funding and the rehabilitation efforts of the leopard cats in general and the other animals.
Would you say that in Vietnam there is a lot of interest in wildlife conservation and wildlife veterinary medicine?
5 or 7 years ago, not really, but this time I can see it through the vet student club. It's like they actually have more students get know to it and want to join the club, want to learn about wildlife. So I would say like it's improved a lot, and people now do care a lot about wildlife too.
What questions regarding leopard cat clinical care would you like to see answered in the next 5 years?
I would say that the disease surveillance in the populations, for example, like the viruses. Right now in Vietnam, we have the laws that we do not allow to inject the live vaccines to the animals that we're gonna release. And we don't have that vaccine in Vietnam. So I would like to know if they have these kind of viruses already in wildlife, so we can decide if we gonna give the vaccination to help them better or we just leave it. Also, I'm quite interested in the rehabilitation success rates. We right now just monitor by observation. We don't really have any equipment or radio tracker to actually track them and know like how long they survive. And also the genetic diversity monitoring. As we all know that right now the environment, the habitat loss is one of the most important like consider things. And I'm wondering if we keep rescuing and release in quite amount, not a lot of forest that we having right now, will they have like inbreedings or something like that? Or the rescue center also rescue and treat the leopard cats. They just show me the information that they actually saw the leopard cats territory is like 20 kilometers square, which is quite a lot. And it can help for us if we know exactly their territory areas in the wild, so we can choose the location to release better.
And what's the biggest prey items that leopard cats take in the wild?
They eat quite a lot of things, pretty much small things like ferret, mongooses, rats, wild chicken, also reptiles. I saw some of the leopard cats sometimes playing with worms and insects, and they also eat it sometimes, but it's not their main diet.
Where do our knowledge gaps in leopard cat clinical care in Vietnam lie?
I would say like disease scanning, because some of the leopard cats that we rescue from directly from the wild, like they just get it and we rescue them. We already saw like parasite, intestinal parasite or something like that, which mean and they still survive. So it make me wonder like how severe of the infection that we need to involve or we need to actually treat it. We don't know that yet. Uh, as I say, like the rehabilitation outcomes and nutrition plan study, we don't know exactly how many percentage of protein, fat, or minerals that they actually need. We do know that 20 to 30% of the food amount of food compared to the body weight every day, but we don't know exactly of the components.
Can you suggest a research topic for a veterinary medicine student watching this and who wants to work with wildlife?
I would say zoonotic disease, which is also relate to One Health, and maybe would be better if we have the effective non-invasive technique to monitor or doing leopard cats health assessment. Like without have to catch them or have to do something more stress for them and the impact of the habitat loss.
What advice can you offer new entrants into wildlife biology or veterinary medicine wanting to work with wildlife in Vietnam?
I would say if we want to work in Vietnam with leopard cats, pretty much we need give like more hands-on few experience. For example, like intern in rescue centers, intern in NGOs. If you're researchers or something, like you can try to join with the patrolling or something, doing some research and develop like the networking skill by collaborate or connect with the other conservation organization and get the information or the knowledge or exchange it together so we can get a better opportunity to help them.
Anne, you are a veterinary surgeon with the organization Saving Vietnam's Wildlife.
Hey, Vietnam
Thank you for
Wildlife.
such a wide-ranging interview. It was fantastic. Dr. Anh Ngoc Truong.
Thank you. I appreciate it.